Hello, Kevin Trubenbach here. Welcome back to our YouTube channel. Today, we're going to be going over the moving parts of the Inflation Reduction Act signed into law by President Biden in August of 2022. So you might have an Affordable Care Act plan now, or you might be new to the Affordable Care Act plans. You are guaranteed to learn at least one thing today. So our agency, we work with the marketplace in Wisconsin and several other states, and it's at no cost to you. Some important dates: open enrollment goes from November 1st through January 15th of 2023. If you apply by 12/15, you'll get a 1/1/23 effective date. Apply after 12 or from 12/16 to January 15th, you'll get a 2/1 effective date. Note, our agency, we also work with all types of Medicare plans and alternative health plans as well. Many of you are current clients watching this video. You may work with one of our Rockstar associates listed here. So the Inflation Reduction Act signed into law in August. It has now extended the Affordable Care Act expansion program for 3 years through 2025, which is great news. It means higher income earners can now make above the 400% of the FPL or federal poverty level and still get a subsidy. So you may now qualify for a subsidy or tax credit in 2023. The 400% household cap is no longer in effect. Honestly, the easiest way to figure out if you get any type of subsidy is you can use the links in the description below, and under 2 minutes, you can figure out if you qualify or don't qualify. These are the new guidelines for 2022 into 2023, which will go into effect starting November 1st. So you do not have to be below the $54,000 of income if you are a single. You can now make above that amount based on your ages, where you live, household. So that's what has those factors built in to see if you qualify for the subsidy. Along with that, I've highlighted these yellow boxes here, and these are also known as CSR or cost share plans. So think of it this way: the lower the income you make, the better plan design that the government gives to you. So they're known as cost share reduction plans. On HealthCare.gov or the marketplace, you'll see those noted at extra savings. That's how they kind of categorize them. On our system, it shows as a CSR. Our system is fully integrated with HealthCare.gov. What's nice about it, you never have to leave or go to the HealthCare.gov site. So from start to finish, you can view all of your options in whichever state you're viewing. Moving on. Did you know in 2023, you're going to make your best guess on your household income? We want to be at close. Estimates are fine, but you're off by a couple $1,000s. It's not going to make a big difference. The amount you owe or get back is a few dollars come tax time. It averaged in 2022 for Wisconsin about $70 per month for every $10,000 of dollars or income that you are off. So our goal is not to have anybody get back or owe back thousands of dollars. So as long as your income's close in 2023, how that's kind of when you file your taxes. So at the end of the year, when you file your taxes, it's the difference in the subsidy that you will owe or get back at tax time. And then with this 8.5% income cap, remember, if you go above the set income, then you would owe back the entire subsidy and you'd pay that back at tax time. So for example, higher income, so 8.5%. So we'll take a person here that makes $100,000 of income. Currently, and this is what's been extended for the next 3 years, is the maximum you would pay at $100,000 of income is 8.5% of that. That's $8,500 a year would be the maximum you have to pay for a health insurance program. So yes, you can make higher income now and still get a subsidy. That's what's been expanded for the next 3 years. So our agency, we're here to help you from start to finish. Our recommendation and steps are below. If you're on a current ACA plan now, the 2023 renewal that you're getting in the mail from the current insurance carrier is more than likely wrong. What I mean by that is the renewal, the health insurance rate is correct. So what you're getting mailed from the carrier is correct. But the subsidy amount used to generate your renewal, the insurance carrier pulled in your 2022 subsidy. So when the letters were printed, the carriers did not have the 2023 subsidy amounts yet. That is why it's important to see what your subsidy amount is for 2023. 99% of the time, it is a different amount from 2022. You can use our links in the description below to figure out what exactly that amount is. If you're new to our agency, welcome. If you currently work with one of our Rockstar associates, you can use their personal link in the description below to run those rates in under 2 minutes. If you're new, pick any associate. We'd love to work with you, and we help at no cost to you. So what you're going to do is follow these steps. You're going to click on one of those links below, follow the prompts. You'll need your estimated 2023 income. You can run the rates and see what your subsidy will be in 2023. Here's a little tech tip for you. Since those renewal letters you're getting from the insurance companies more than likely are going to be wrong, your current clients on the ACA plan now, the renewal that you're getting in the mail, what you can do is run your 2023 subsidy. We are assuming your income is the same for 2022 versus 2023. Then you can subtract that new subsidy amount from your health insurance renewal. That will be your 2023 rate. If you are okay with that new rate, your plan will automatically renew into 2023. A final letter will be mailed out to the or from the insurance company to you, typically November, December. And remember, it's your household income for 2023 that is going to determine your plan and your rates. So when you click on the quoting link, we encourage you to fill in your name, phone, and email. This is completely optional, as only your agent will get that information. Our system is fully integrated with HealthCare.gov. However, you never have to go to HealthCare.gov website. You can add in your preferred doctors, your medications. You can skip that. There's also, if you're comfortable, you can use the agent's link and apply for the new insurance. If you're not sure, you can add your email to save the quotes. Once again, you don't have to put in your name, your address. You have to put in your zip code and your 2023 income and the ages, but no personal information is needed to run the quotes. And if you want, you can put in your email to save those quotes. If you are confused, then please email your associate, call, or schedule an online appointment. If you do not qualify for a subsidy, then contact us for alternative options. And then as a reminder, the Affordable Care Act, Marketplace, HealthCare.gov, they all mean the same thing. These ACA plans must cover all pre-existing conditions. The ACA plan have to cover preventative care at 100% prior to your deductible, as long as you use in-network facilities. The insurance carriers, all of them have certain hospital groups that you must use for your care. If it is emergency care, all plans cover you in or out of network due to the new Surprise Act that was announced in 2022. You can read about it by clicking on this link. This document will be fully downloadable in the description below. And also, new plan designs, what we're seeing popping up in multiple markets, happened in 2022, but many of the ACA plans based on where you live are offering a $0 deductible copay plan. So you have copays for services with no deductible, but those copays all go towards your out-of-pocket maximum. Note in 2023, the maximum out-of-pockets cannot be more than $9,100 for an individual or $18,200 for a family. So keep an eye out for these new plans. We're seeing them in multiple markets. Also, our agency, we're here to help you guide you through this lovely world of insurance. We have over 300 plus Google reviews. We're here to help you. So follow us on our social media, Facebook, LinkedIn, call or text one of our team below. These are all the links that you can run rates. If you're from outside of Wisconsin, you can use my link, which will have access to multiple states, 30 plus states. So we are here to help. We look forward to working with you. And if you have any questions, give or call to our office. Thanks much.